Welcome back. You're watching McLaren Port Huron's Today's Health, and I'm talking with board-certified obstetrician gynecologist Dr. Karen Niver. In this segment, we're going to be talking about infertility risks as you age. Dr. Niver, can you define infertility for us?
Sure. Infertility, by definition, is the inability to conceive after 1 year of unprotected intercourse and regular relations.
Why is fertility an issue as you age?
Because it becomes more difficult to conceive as you get older, and that's for a variety of reasons. The evaluation for infertility in the office is to look for an etiology. About 25% of infertility cases are male factor, about 50% are female factor, and about 25% are unexplained.
What are those male factors?
Male factors can be an issue with the sperm, either sperm count, sperm concentration, the pH of the semen, the viability of the sperm, the morphology, the tail and head components, and the ability of the sperm to actually penetrate the egg.
And how about the female then?
Females can be a little bit more complex. It can start with an ovulatory factor, where the eggs are being produced, the quality of eggs or the frequency of ovulation. It can be a tubal factor. Of course, the fallopian tubes are the conduit from when the egg is ovulated. The egg goes through the tube and hopefully implants in the uterus. If the tubes are blocked, if there's endometriosis, if there's adhesions or kinking, the tubal factor can be an issue. The uterine environment can also be an issue. If there is a septa or a wall in the uterus, if the uterus is misshapen, a bicornuate uterus, if there are fibroids or polyps or issues in the inner wall of the uterus, all of these can be issues. There's a cervical factor, just following the anatomy down. We also sometimes find that there's actually a component or an issue with the methodology by which the couple comes together. If they are using some type of an unusual lubricant or different products, that can slow down the system or monkey up the system.
So some of these things are maybe from, like you said, structural or but are some just more so as you age? These factors change as you age?
Well, the integrity of the eggs certainly change when we age. So that would be, something to consider. As we age, we're more likely to have thyroid issues or other systemic health issues. So all of those things can come into play as well.
So women of or couples of advanced maternal age do need to keep in mind that that these might be issues.
Yeah, that time can be important.
Yeah, time can work for you, time can work against you.
That's correct.
How do you make the diagnosis of infertility?
Again, if a couple has not been able to conceive within a year, 85% of couples will conceive spontaneously within a year of regular timed intercourse. And when that's not happening, of course, we start our evaluation, but we also consider the timing of when a couple comes together. Today, there are ovulation predictor kits that are very available and very inexpensive to take or to purchase. We recommend timed intercourse every 1 to 2 days around the time of intercourse.
Are there actual tests that you do to determine if everything is well?
Yep. We would start with a semen analysis on his end, and then on the lady's end, we would do some timed hormonal tests when we feel that ovulation in the cycle is appropriate. Basic tests in terms of thyroid function studies, anatomic tests in terms of a hysterosalpingogram, which is an X-ray study to look at the integrity of the tubes and the uterine environment, or a hysterosonogram, which is a different spin on that, where we actually put a little camera through the cervix and distend the uterine cavity with saline or water and actually look at the environment.
Are there treatments available locally if you find a problem?
Yes, the first thing we would do is talk about ovulation induction, because we find oftentimes that that's where the issue would lie if the rest of the studies are coming back normal. Ovulation induction locally would be by means of a pill that is taken for 5 days, and then sometimes an ultrasound mid-cycle when we think ovulation should be occurring, and then an injection to help the egg to actually release and ovulate, and then timed intercourse. Sometimes if there's a male factor identified, we would also do an intrauterine insemination where the male partner would go to a center and give a semen sample. The semen sample is spun down and concentrated and prepared and placed in a little syringe, and then we actually in the office would inject that super concentrated specimen in the uterus when we think the timing is appropriate for ovulation.
At what point do you refer a couple to like an infertility center or something like that?
Well, if a woman is of advanced maternal age, I would probably refer very quickly. I would probably even forego these local treatments because time is becoming more important. And we're doing so much better now with the advanced reproductive technologies, such as in vitro fertilization, that I think the time and money is better spent that way. If it's a younger couple in their 20s, we would start with these local things, and if pregnancy didn't occur within the first 3 to 5 cycles, we would refer.
This has been great information. We're all up to date on a really important topic. Do you have any closing comments for us?
Just that the journey is so rewarding, even in your 30s. I didn't have my son till I was 37, and I didn't realize what a life-changing event motherhood is. There is no joy, no contentment deeper or more profound than becoming someone's mother. So I would say if that is your goal and that is your intention, you go for it and let us know how we can support you, and you will never be the same.
Thank you so much for joining us.
Thank you, Barb. It's been a pleasure.
And thank you for joining us. We've given you a lot of important information today. So if you have any questions, call us at Health Access. That's 1-800-228-1484. Or you can go to our website, mclaren.org/PH contact. Now, if you want any reliable health information or a copy of this program, please go to our website. That's mclaren.org/PHTH. As always, we hope you join us again for Today's Health. Today's Health is brought to you by McLaren Port Huron, doing what's best.